In the study of anatomy, it is important to understand the structure of tubes. Why, you might ask? Well, tubes are the foundation of a large majority of the body's organ systems. It is difficult to explore a body and not encounter tubular organs. A quick survey reveals this simple truth. The digestive system is a system of tubes. The respiratory system is a system of tubes. The urinary system is a system of tubes. The cardiovascular system is a system of tubes. And the genital system is a system of tubes. So no matter how you cut it, it is quite evident that the body consists of quite a large number of tubes. Furthermore, organs that people might consider to be solid organs are in reality intimate, intertwined masses of tubes. For example, the lung is a large branching network of air-filled respiratory tubes and an intimately associated network of blood vessels. The liver is nothing more than an extensively branched network of biliary tubes associated with a neighboring grid of blood vessels. A final example, the kidney, is nothing more than a complex arrangement of urinary tubes and intimately associated blood vessels. So we can see that tubes are everywhere in the body. Because of the widespread nature of tubes, it is important to understand their anatomy. The following objectives are the keys to understanding the anatomy of tubes. Tubes share a common structural pattern. This pattern is found in all tubular body systems. Understanding the pattern simplifies the learning process. Modifications of this pattern account for the function of the tube. These modifications allow us to understand the structure-function relationships of tubular systems as we apply critical thinking to our understanding of anatomy. Now, with these objectives in mind, let's explore the anatomy of tubes. As the first objective stated, all tubes share a rather simple basic structure. That shared structure is that tubes have 3 layers, or what we call tunics, of anatomy. The word tunic, which we will see often in the anatomy of tubes, simply means in Latin a garment of clothing. So just as we might wear various layers of clothing, tubes are comprised of 3 distinct structural layers of anatomy. As we explore the structure of a tube, let's begin with the inner layer of the wall and simply call this layer the internal layer, which of course it is. As you learn more anatomy, you will learn that anatomists refer to this layer as the tunica mucosa or tunica intima and its associated tela submucosa. The tunica mucosa or tunica intima lines the tube and is always some kind of an epithelial tissue. These 2 names arise from the fact that they are either mucus-producing tissues or they are the most intimate layer with the contents of the tube. The submucosa is typically a less well-defined, variably thick layer of vascular loose connective tissue and is closely associated with the epithelial layer. The name tela, meaning a net, comes from the net-like arrangement of fibers in the loose connective tissue. Therefore, the tunica mucosa and associated submucosa comprise the internal layer of the 3-layered tube. The second layer of the three-layered tube is logically referred to as the middle layer. Anatomists refer to this layer as the tunica media or tunica muscularis. Tunica media because it is the middle of the three layers. Tunica muscularis because this layer is often dominated by smooth muscle tissue. This middle layer is typically the thickest part of a tube and is usually a combination of muscle and connective tissue in varying proportions, depending on the functional requirements of the tube. The final layer of the tube, being the outermost layer, is called the external layer. Anatomists name this layer the tunica externa or tunica adventitia. Two good names. The logic in the name externa, meaning outside or external, is quite obvious. The term adventitia comes from the Latin and translates as to come from the outside, which then is also a logical name. This tunic ranges from a very thin to a relatively thick layer of dense, irregular, fibroelastic connective tissue. It reinforces the tube and supplies the tube with nutrient-carrying blood vessels. Now that you have this foundation knowledge of tubular anatomy, you are ready to explore the various tubular systems of the body. Each new tubular system follows this structural pattern, and through modifications of the tissues and their arrangements within the three layers of the tube, you will both understand and be able to critically think about the structure-function relationships that account for the different distinct functions of each specific body system.